Hi, I'm Brianna Castellanos, and I'm here to teach you a few different nursing positions and holds that might work best for you. Maybe you've just recently had a baby and you're sitting back thinking, wow, this is not like I saw it in the movies. This does not feel as organic as I've seen it to be. Am I doing something wrong? I do want to encourage you that you are not doing anything wrong. Nursing takes time, practice, and patience. But there are a few things that no matter what position you use and no matter how you're trying to breast or chest feed your baby, that everything has in common. Number one is that you are developing a special bond with your baby every time you bring your baby to your chest for a feed. Secondly, when you are nursing your baby, oxytocin is flowing through your system, creating all of those feel-good hormones that cannot be replaced by anything else. It's also good to know that not all nursing positions are right for certain shapes of bodies and statures of bodies. And so knowing what types of positions might work best for you and your body type can bring you a lot more security. And remember, it does take time for your baby to learn your breast and for your breast to learn your baby. And so don't worry if it seems like it's taking forever. Just keep at it a little at a time and you will have success. The thing that we want to focus on today is 4 different positions that work for most people. So let's get into it. What do all these positions have in common? Well, number one, your baby is close to you and their body is supported so they feel anchored to you. Great thing. And number 2 is that your baby's ear, shoulder, and hip are all in line and facing the same direction in a straight line, no matter what position you are practicing. Also, your hands and arms are supported during the entire feeding session so that you don't get tired. Now, let's talk about the positions.
This first position is called the laid back position. This is a great position because your baby feels in control and close to you. Support yourself with many pillows and lean back. Your baby's body is on top of your body in this position, and it is a great way if you have just had a baby or have had a C-section. Lean back with a pillow behind you and place your baby tummy to tummy with your hand underneath their bottom and have their head come close to your breast to support baby. Tip your breast and nipple towards the roof of baby's mouth and allow baby to get a big mouthful of breast. They will bobble around a little bit, trying to figure out how to place on, but this is a great position and is usually easy for most nursing parents. This particular position is very helpful and comfortable and comforting and can be done in any place. The next position is called the cross cradle hold. This is how you are able to support your baby at all times during the feed. You use your opposite arm on the breast or chest that you are feeding from. You will have your baby's ear, shoulder, and back aligned, and you will support your baby's neck with the opposite arm from the breast that you are feeding from. Your fingers shouldn't be higher than the base of your baby's head, and keep your baby close while you're doing this position. This allows you to help support baby's head and bring them close to your breast. We want to bring the baby to your breast, not the breast to your baby. Sometimes it's helpful to use a pillow underneath. However, this position might not always be helpful if you're larger bodied or if you have short arms. A simple alternative to the cross cradle hold is the simple cradle hold. In this position, you will hold your baby as if you were cradling a doll, and you will support your baby with the arm that is closest to the breast that they are feeding from. Their head would be typically near your elbow and where your nipple is pointing. So keep your baby close to the side of the body of the breast that you are feeding from and bring their nose to the nipple, and make sure you try and brush the chin and lower lip against the breast, which will encourage baby to open their mouth wide. When they are deep in a latch, bring your baby close by adjusting your arm. You can use your free arm to support baby's hand, pet baby's hair, and whatever feels comfortable. The football hold is great for someone who has just had a baby, perhaps someone who has multiples, or even someone who is struggling with different positions. Support yourself with multiple pillows, semi-reclined in bed, and then lay your baby alongside of you. There are two variations to this. One where baby is flat on the back, particularly if you have nipples that point down. The alternative to this position would be to have baby on their side if you have nipples that point towards the side. This will allow you to position baby comfortably and nurse. For some smaller babies, this position may not be super easy or beneficial, but can be in the latter weeks as you overcome some nursing challenges. This position is also helpful if you have large breasts. The side-lying nursing position is a comfortable position for most nursing parents, especially at night. But if you do decide to do this at night, make sure you follow safe sleep recommendations for you and your baby. Lie down on your side with one arm bent, supporting your head so you can see exactly what's going on with baby's nose and mouth. Bring your other arm around to baby's body and bring their nose to your nipple. And again, brush their chin with your nipple to encourage a wide open mouth to reach up for the breast. You can place your hand on the shoulder or their head to comfort baby, and make sure you stay awake. And once they are latched, you can lie down and keep the arm behind your baby's shoulder to make sure that they are close to your body. This position may not be super easy in the early days, but never feel discouraged and try again as they age.